This video references the agency's former name, the Executive Office of Elder Affairs, and features former Secretary Elizabeth Chen. The agency is now the Executive Office of Aging and Independence, reflecting our commitment to reducing stigma, promoting independence, and embracing aging as a natural process. While the content remains relevant and accurate, inclusive, person-centered updates are underway to align all materials with our current mission, values, and leadership. Welcome to an introduction to Adult Protective Services. This project is brought to you by the Massachusetts Disabled Persons Protection Commission, DPPC, in partnership with the Building Partnerships for the Protection of Persons with Disabilities Initiative, BPI. BPI is a Massachusetts statewide multidisciplinary initiative that links law enforcement, persons with a disability, adult protection, disability services, victim services, medical personnel, and others to address abuse, neglect, and crimes committed against persons with a disability. BPI partners include DPPC, the Executive Office of Elder Affairs, EOEA, the Department of Developmental Services, DDS, the Department of Mental Health, DMH, the Massachusetts Rehabilitation Commission, MRC, the Department of Public Health's Sexual Assault Nurse Examiner, SANE, the Office of the Attorney General, the Massachusetts District Attorneys Association, MDAA, and Massachusetts Advocates Standing Strong, MAS. This project was supported in part by a grant from the U.S. Administration of Community Living, ACL, Department of Health and Human Services in Washington, D.C. Grantees undertaking projects with government sponsorship are encouraged to express freely their findings and conclusions. Points of view or opinions do not therefore necessarily represent official ACL policy.
APS is important because it's about seeing people who are mostly unseen. It's about giving them humanity, giving them our humanity, and it's about getting people to a safer place.
We are in the job of saving persons' lives, and the work can be extremely difficult. It is extremely difficult.
This has helped me to grow personally. I have a clearer understanding of what it is to embrace everyone.
I've interviewed so many people that say they want a job that means something, and this job means everything. If you want a job that matters, this is the field.
The goal of this video series is to highlight the prevalence of abuse against persons with a disability and older adults. More importantly, we will provide you with the tools and best practices to recognize and report abuse, as well as how to effectively respond to it. According to the Centers for Disease Control and Prevention, a disability is any condition of the body or mind that makes it more difficult for the person with the condition to do certain activities and interact with the world around them. Disability and aging are connected. We know from research that although disability is sometimes present at birth and onset can occur at any point during life, the likelihood of experiencing disability increases with age. To illustrate, almost half of adults over the age of 74 live with a disability.
Abuse of persons living with a disability and older adults occurs throughout the country and is commonly categorized as physical abuse, emotional or psychological abuse, sexual abuse, neglect, financial or material exploitation, abandonment, and self-neglect. For adults 60 and older who live at home, about 1 in 10 have experienced abuse, including neglect and exploitation. Older people with dementia are particularly susceptible to abuse. Nearly 1 in 2 older adults with cognitive impairment experience abuse.
The National Crime Victimization Survey, reporting from 2010 to 2014, found people living with disabilities are 3 times more likely to experience serious violent crime, including sexual assault, aggravated assault, and robbery, than those without disabilities. Societal attitudes and structures often create vulnerabilities, such as ageism, which is discrimination based on a person's age, ableism, discrimination in favor of able-bodied people, or discrimination based on race, gender, religion, or sexual orientation. When persons with a disability or older adults are perceived by others to possess or not possess certain abilities, skills, or character orientations, the risk is further increased.
Persons with a disability and older adults who are abused and neglected may experience a range of challenges, including physical deterioration, hospitalization, increased mortality, depression, suicidal ideation, disrupted relationships, and financial loss. In turn, these can lead to diminished independence and quality of life. Research findings illustrate that adults living with a disability are among our nation's most vulnerable citizens. For adults living with a disability, vulnerability is often heightened when the individual is dependent upon a caregiver. The close personal contact involved in assisting adults with a disability with daily living activities such as bathing, dressing, and personal hygiene can create dependence upon the caregiver. These close personal contact situations are complex and often not well understood.
The inherent power imbalance between caregivers and adults with a disability when hands-on care is needed places adults relying upon that care at risk for sexual, physical, and emotional abuse, financial exploitation, and neglect. State laws and agencies that define and address the victimization of persons with a disability and older adults differ to some extent, but are also remarkably similar. This video series is produced in Massachusetts, and therefore information specific to Massachusetts is presented. Specific state laws and agencies that handle adult abuse and reporting requirements can be found here.
There are 4 state protective services agencies in Massachusetts that respectively receive and respond to reports of abuse and neglect committed against children, persons with a disability, older adults, and patients in long-term care facilities, such as nursing homes. The Massachusetts Disabled Persons Protection Commission, DPPC, and the Executive Office of Elder Affairs, EOEA, are discussed in depth in the video, including their population served, mandated abuse reporting requirements, and processes used when reports of alleged abuse are received. To respond to pervasive abuses committed against persons with a disability and older adults, protective service agencies have been formed in Massachusetts and throughout the country. This video will introduce you to the continuum of protective services, with an emphasis on adult protective services in Massachusetts. Before we focus in on Massachusetts Adult Protective Service Programs, or APS as it's often referred, let's more broadly explore the necessity of protective services. Protective services are provided by governmental agencies or private organizations that receive and respond to reports of abuse, neglect, and exploitation of children, adults with a disability, and older adults. Child Protective Services, CPS, is responsible for the protection of children through the age of 17. Adult Protective Services, APS, is responsible for the protection of adults with a disability 18 and older, and older adults starting at the age of 60 or 65, depending on individual state laws. Protective services often include the investigation of reports of alleged maltreatment or abuse, assessment of risk, and the need for services or assistance in obtaining appropriate social services, including medical and legal services.
APS differs from state to state in terms of provider agencies and program composition, individual eligibility requirements, and the standards of practice. In most states, APS serves vulnerable adults or adults 18 and older with a significant physical and/or cognitive impairment. Although there are differences between state APS programs, APS generally serves adults with a disability and older adults with or without a disability. The National Adult Protective Services Association, or NAPSA, is a national nonprofit organization with members in all 50 states and the territories. Formed in 1989, the goal of NAPSA is to provide adult protective service programs and related fields such as law enforcement, research, the medical and legal fields, and the financial services industry, a forum for sharing information, solving problems, and improving the quality of services for victims with a disability and older adults. NAPSA's mission is to strengthen the capacity of APS at the national, state, and local levels to effectively and efficiently recognize, report, and respond to the needs of adults with a disability and older adults who are the victims of abuse, neglect, or exploitation. and to prevent this abuse whenever possible. If you want to learn more about APS or where to report vulnerable adult abuse in your state, contact NAPSA at napsa-now.org or by phone at 202-370-6292.
Now let's focus on what protective services looks like in Massachusetts. There are 4 state protective services agencies in Massachusetts that protect children, adults with a disability, older adults, and patients in long-term care facilities, such as nursing homes. Each agency is responsible for receiving and responding to reports of abuse and neglect in the population it serves. The Department of Children and Families, DCF, is charged with protecting from abuse and neglect children through age 17. DCF works to establish permanency and well-being of children by providing supports and services to families at home when it is safe to do so. When necessary, DCF provides foster care, and if parental reunification is not possible, finds new permanent families through kinship, guardianship, or adoption. To report abuse or neglect of children in Massachusetts, contact DCF's Child at Risk Hotline at 800-792-5200 or 711 for TTY. The Department of Public Health, DPH, is mandated to license and certify health facilities, including hospitals, nursing homes, and home health agencies. DPH also investigates complaints of patient abuse and neglect in long-term care facilities and hospitals. To report abuse or neglect of a patient in a nursing home or hospital, call the Department of Public Health at 800-462-5540 or 711 for TTY. You can also contact the Community Care or Long-Term Care Ombudsman Program at 617-727-7750 or 711 for TTY. The Ombudsman Service offers a way for consumers to voice complaints and concerns. Now that you know where to report abuse or neglect of children and patients of long-term care facilities, we turn to the Massachusetts Adult Protective Service, APS state agencies, specifically the Disabled Persons Protection Commission, DPPC, and the Executive Office of Elder Affairs, EOEA. We will start with DPPC.
It's about respecting persons with disabilities. It's about believing persons with disabilities. It's about providing persons with disabilities opportunities that so many others have that they often don't have. DPPC was created in 1987 as an independent state agency responsible for the investigation and remediation of abuse against persons with disabilities. DPPC's mission is to protect adults with a disability from the abusive acts and omission of their caregivers through investigation, oversight, public awareness, and abuse prevention. DPPC provides protection to adults with a disability between the ages of 18 and 59 who are victims of abuse by an act or omission of a caregiver. Abuse includes inappropriate physical contact, sexual acts, and the improper withholding of adaptive aids, such as devices required for the person with a disability to ambulate, hear, or communicate. Protections are provided to victims with a disability whether the individual is in state care, a private setting, or in the community. DPPC can investigate abuse in private homes, state-operated programs, transportation services, and correctional facilities. The only place DPPC cannot investigate is a long-term care facility, which falls under the jurisdiction of the Department of Public Health. Although an independent state agency, DPPC was designed to be one of several state agencies with complementary missions, including the Executive Office of Elder Affairs, EOEA, Department of Children and Families, DCF, Department of Developmental Services, DDS, Department of Mental Health, DMH, Massachusetts Rehabilitation Commission, MRC, and law enforcement. Replacing none of them, DPPC was designed to closely coordinate its work with all of them.
In response to a system-wide failure in 1999, law enforcement, district attorneys, APS, and disability services committed to work in a collaborative, multidisciplinary fashion, breaking down historic silos. This partnership continues today and is known as the Building Partnerships for the Protection of Persons with Disabilities Initiative, BPI. Over the years, BPI has developed its knowledge and understanding of best practices to meet the needs of persons with a disability. Through BPI, APS, law enforcement, prosecutors, victim witness advocates, sexual assault nurse examiners, provider staff, and persons with a disability are trained and cross-trained to increase the competence of each discipline and enhance the coordination of the recognition, report, and response to the abuse of persons with a disability.
DPPC, like DCF for children and EOEA for older adults, acts to protect adults with a disability who are dependent on others to meet daily living needs. DPPC fills the gap in the continuum of protective services in Massachusetts between child protection, age 0 through 17, and older adult protection, age 60 and older. Several agency units comprise DPPC, including learning and development, intake, oversight, investigation, legal, and quality assurance. It also includes a sexual assault response, SAR team, funded by a Massachusetts Office for Victim Assistance grant. In addition, DPPC has a state police detective unit, known as the SBDU, that is staffed with a sergeant and 4 troopers. Now let's meet some of the DPPC team and learn about their work.
When you look at your life's work or where you spend so much of your time and with whom you spend it, if I've done my piece and done it well, then I am so grateful for all the other people that are involved in sort of getting us to the point where we're actually able to make a difference.
The DPPC's intake unit receives reports of abuse against persons with a disability from a 24-hour hotline and through an online portal. Anyone can and should report abuse of persons with a disability, but some people are required or mandated by law to do so. Mandated reporters are people who are likely to observe or suspect abuse based upon the work that they do.
The list of DPPC mandated reporters include any physician, medical intern, or hospital personnel engaged in the examination, care, or treatment of persons, medical examiner, dentist, psychologist, nurse, chiropractor, podiatrist, or osteopath, public or private school teacher or educational administrator, guidance or family counselor, daycare worker, probation officer, animal control officer, social worker, foster parent, police officer or probation officer, employees of state agencies within the Executive Office of Health and Human Services, and employees of private agencies providing services to persons with a disability.
Mandated reporters have a legal obligation to immediately report to DPPC when they have reasonable cause to believe that an adult with a disability has suffered a serious physical or serious emotional injury caused by an act or omission of a caregiver, including non-consensual sexual activity. However, anyone can make a report, mandated or not.
Once DPPC receives a report of abuse, a determination is made regarding whether the situation is an emergency or non-emergency and whether the allegation meets DPPC's jurisdictional criteria. If a reported situation does not meet DPPC's criteria for investigation, the complete allegation report is forwarded to the protective service agency appropriate to the individual's age and/or disability. DPPC operates on a no wrong door policy. DPPC's intake specialists elicit from the reporter all the information of abuse, regardless of whether DPPC is the appropriate agency to investigate. For example, if an alleged victim is under the age of 18, the intake report will be referred to DCF. If the victim is 60 years of age or older, the intake report will be referred to EOEA. If alleged abuse occurs in a skilled nursing facility or hospital, the intake report will be referred to DPH.
When we conduct investigations on behalf of a population that may not have a voice or may be a subject of abuse, we have an opportunity to give them new life and to give them a voice where, in fact, they can share with others the abuse that they face and what it feels like to no longer be under that abuse. For the DPPC to investigate abuse committed against persons with a disability, the victim of the alleged abuse or neglect must be between the ages of 18 and 59 years, have a disability due to a mental illness, intellectual, developmental disability, or physical impairment, and as a result of the disability, require the assistance of a caregiver to accomplish daily living needs. Also, the incident must include an act or omission, neglect by a caregiver, and result in a serious physical or serious emotional injury or abuse per se. Abuse per se does not require the reportable incident to result in serious physical or serious emotional injury. Examples of abuse per se include sexual abuse, withholding of adaptive aids such as a wheelchair, cane, communication board, when it is unrelated to the person's care needs and safety. Pattern of inappropriate touching that is non-sexual, and this repetitive touching is not needed for the person's care or well-being. Improper physical redirection, unnecessary restraint, assaultive conduct but with no injury, such as slapping, pinching, etc. Reports of alleged abuse or neglect that remain with the DPPC are immediately assigned to an APS investigator and a DPPC oversight officer. The APS investigator may be one of DPPC's investigators or an investigator from the DDS, DMH, or the MRC, all of whom conduct investigations under DPPC's statutory and regulatory authority. The assigned investigator is an objective fact finder, collecting evidence and conducting interviews to determine if abuse took place, and if so, the person or persons responsible. If the investigator finds that abuse occurred, recommendations of protective services are required to be included in the investigation report to support the victim and/or to prevent future abuse. The primary focus of all APS investigations is to stop the abuse and to provide appropriate protective services, always balancing safety risks with a person with a disability's right to self-determination.
This work provides the opportunity for all people to have the same access to the criminal justice system. It's rewarding to be able to help people. The State Police Detective Unit at the Disabled Persons Protection Commission review every hotline report received by DPPC to determine if reported incidents suggest criminal activity committed against a person with a disability. The State Police refer reports of alleged crimes to the appropriate prosecutor's office for review and possible criminal investigation. If the prosecutor recommends a criminal investigation, it will be assigned to one of three law enforcement agencies: the Disabled Persons Protection Commission State Police Detective Unit, the State Police Unit assigned to a prosecutor's office, or local police. Efforts are made to coordinate APS and criminal investigations through established memoranda of understanding between the DPPC, the Department of Developmental Services, the Department of Mental Health, the Massachusetts Rehabilitation Commission, and each of the 11 prosecutors' offices in Massachusetts.
There are so many partners we count on to help us get from point A to point Z.
The Disabled Persons Protection Commission Oversight Unit is responsible for monitoring all DPPC investigations. Every case, rather investigated by DPPC, DDS, DMH, or MRC, is monitored by one of DPPC's oversight officers to ensure that the alleged victim is safe, the report is timely, and the investigation is thorough. In cases where abuse by a caregiver is substantiated, the appropriate state disability agency provides protective services to the victim, specifically DDS, DMH, or MRC. To confirm that necessary protective services are implemented, DPPC oversight officers monitor cases until risk of harm to the victim is adequately reduced or eliminated.
Sexual assault can be hard on everyone, even without people with disabilities.
I've gone through it, I can do it, and I can help other people heal.
Look at the trauma, not the disability.
In July of 2017, DPPC created a Sexual Assault Response Team, also known as SAR, to increase access to trauma-informed support services for persons with a disability, which was made possible with funding from the Massachusetts Office for Victim Assistance and the Federal Victims of Crime Act. SAR team members review all reports of alleged sexual abuse received by DPPC's 24-hour hotline and online reporting. SAR team members work with sexual assault victims with a disability, their families, and support teams by providing information, resources, referrals for services, and peer support. The goal of SAR is to increase access to trauma services for persons with a disability to aid in their recovery from sexual abuse. For me, I know that when I go home that I am making a difference because I've tried to make a difference in someone else's life.
DPPC's legal unit provides legal advice and guidance on a variety of matters. This includes assistance to DPPC staff and investigators from DDS, DMH, and MRC. In addition, DPPC's legal unit performs the following functions: secures access warrants when law enforcement and/or adult protective service investigators are unreasonably denied access to an alleged victim of abuse. We obtain judicial protective orders when an alleged victim of abuse is at immediate risk of harm and is not able to consent to the provision of protective services due to a mental or physical impairment. The unit responds to reports of mandated reporters' failure to report abuse. We also complete petitions for review requested by the alleged victim, alleged abuser, and other parties involved in an investigation, and make a determination if the findings should be upheld or amended. And finally, the legal unit ensures that responses to requests for DPPC's records are compliant with all statutory and regulatory requirements. In 2020, Massachusetts enacted a law requiring DPPC to establish and maintain a registry of care providers against whom DPPC has made a substantiated finding of registrable abuse. The Abuser Registry is intended to protect persons with an intellectual and/or developmental disability by barring care providers who have a substantiated finding of registrable abuse from working with other persons with intellectual and developmental disabilities. In addition to paid staff, care providers can include volunteers, interns, work-study participants, or any other similar unpaid positions. To learn more about DPPC's Abuser Registry, please visit mass.gov.
Now that we have a better understanding of how DPPC operates, let's turn our attention to the Executive Office of Elder Affairs, EOEA, the APS agency in Massachusetts for older adults.
I know we're doing good work. I know we're looking after people who need to be looked after. And we have a full team of people doing that work. They give of themselves every single day to do the right thing and to care for people so that they're in a safer situation. By 2030, roughly 1 in 5 people in the United States will be aged 65 or older. The U.S. Census Bureau projects that in about 10 years, by the year 2034, and for the first time in history, this country will have a larger number of people over 65 than under age 18. Today, about 1 in 10 older adults have experienced abuse, such as physical abuse, emotional or psychological abuse, sexual abuse, neglect, financial or material exploitation, abandonment, and self-neglect. Older adults with cognitive impairment, such as dementia, are especially vulnerable, with 1 in 2 having experienced abuse. At the Massachusetts Executive Office of Elder Affairs, which we call EOEA, our mission is to ensure that older people can live safely and thrive in the community of their choice. The right to self-determination or personal choice is a central tenet guiding our work.
EOEA strives to balance risk of safety to older adults aging in their community and their right to self-determination or personal choice. EOEA contracts with a Central Intake Unit, CIU, to receive reports and through partnerships with community-based elder service agencies, investigate reports of alleged abuse, neglect, exploitation, and self-neglect of people aged 60 and over residing in the community.
Every year, EOEA's Adult Protective Services Program receives approximately 50,000 allegations of physical, sexual, and emotional abuse, caretaker neglect, financial exploitation, and self-neglect of people aged 60 and over residing in the community. A contracted network of service provider organizations screen, investigate, and coordinate ongoing care. As with DPPC, anyone can report suspected abuse or neglect to EOEA's Adult Protective Services. However, there are some professionals who are mandated reporters. They include, but are not limited to, physicians, dentists, nurses, social workers, therapists, case managers, police, firefighters, EMT, and health and home care aides. Mandated reporters must call the Elder Abuse Hotline when it is an emergency and there is suspected abuse. The verbal report must be followed by a written report submitted to their local protective service agency within 48 hours. In non-emergent situations, reporters may call the hotline and file a written report or use the online reporting tool. All mandated reporters who suspect abuse or neglect must make a report even if they know that another mandated reporter is making such a report. Generally, the identity of the person making the report is kept confidential. However, when we need to refer to the district attorney or receive a court order, we must disclose the name of the reporter. Even if you aren't a mandated reporter, it is important to report suspected abuse. You may be the only contact for the older adult. Hotline reports are answered by EOEA's Protective Services Central Intake Unit 24 hours a day, 7 days a week. If a report of abuse does not meet EOEA jurisdictional criteria and other program or regulatory requirements, the Central Intake Unit will make referrals to the appropriate agencies for intake. For example, if an alleged victim is a person with a disability aged 18 to 59, the Central Intake Unit will directly transfer the caller to DPPC. If the alleged abuse occurs in a skilled nursing facility or hospital, the Central Intake Unit will directly transfer the caller to DPH.
If the report meets jurisdiction and requirements to be investigated under EOEA, it'll be entered into the APS data system and will be forwarded to the appropriate protective service agency contracted with EOEA that serves the area where the older adult lives. Individual protective service agencies receive each report through the CIU or online reporting portal. Protective service supervisors screen each report to determine whether they meet a reportable condition and, if so, determine the level of risk to the older adult. If the report does fit EOEA's criteria, it is assigned to the protective service worker. They immediately assess the level of risk to the older adult and begin an investigation. Investigations can last up to 30 days. The protective service worker first interviews the older adult and collects information to assess the allegation. This information is used to determine whether the evidence confirms abuse or neglect and if available services through provider agencies would be appropriate or beneficial for the older adult in question. If the case is deemed criminal or when there is reasonable cause to believe that an older adult has died as a result of abuse or neglect, the case is referred to the prosecutor's office in the jurisdiction where the older adult lives.
As part of the investigation, protective service workers also gather information from the interview and interactions with the older adults, as well as sources such as police reports, medical records, and interviews with professionals and individuals who have knowledge of the older adult's situation, to assess whether the older adult understands the risks and can make informed decisions about whether to accept or decline services. EOEA must balance the risk of safety with the right of the older adults to self-determination. Any older adult who requests or consents to the receipt of protective services may receive services. If the person withdraws or refuses consent, the service shall not be provided or continued except if there is a cause to believe that the older adult lacks the capacity to consent to protective services. Well, self-determination really is almost the bedrock of what we do. It's really about being able to make your own choices independently about how you wish to live your own life and what you want to do with your own life.
To report the abuse or neglect of older adults, contact 1-800-922-2275 or Deaf and Hard of Hearing, Video Relay Services VRS, or Mass Relay 711, or on the state website.
DPPC and EOEA APS records are not public records. Access to records is limited only to information pertaining to the person requesting the record. Third-party information, reporter information, and personally identifying information is kept confidential to the full extent possible. Massachusetts APS agencies collaborate with NAPSA and several local and statewide multi-jurisdictional agencies and use emergent and best practices to provide for the effective recognition, report, investigation, and prosecution of abuse and neglect of persons with a disability and older adults across the state. Implementation of their agency mandates requires the keen observation of others like you, who interact or may interact with persons with a disability and older adults. The timely recognition and report of any suspected abuse or neglect, and the effective response by all involved in these cases, is key to ensure the protection and safety of all Massachusetts residents. Thank you for watching this introduction to adult protective services.